Hello, good day everyone. You're welcome to my YouTube channel, Pharmaco Healthy channel. My name is Pharmacist. Good luck. And in today's presentation, we're going to talk about the currently trending infectious disease in our dear country, Nigeria. For my fellow Nigerians, it is no longer news that there is an outbreak of cholera infection. I've come to educate us on the virus precautionary measures that we need to take to avoid contracting this deadly cholera infection that is currently wreaking havoc in Lagos State, Nigeria, and few other states in the country. However, before I do that, I will also provide a profound foundation by explaining to us what cholera infection is, the symptoms and complications associated with cholera infection, the cause of cholera infection, the risk factors associated with cholera infection, and the mode of transmission. So we delve into the presentation proper. Don't go anywhere, stay tuned. I'll be right back soon. Hello, you're welcome back to my YouTube channel, Pharmaco Healthy channel. So the question now is, what is cholera infection? Cholera infection is an infection of the GIT that is generally or basically characterized with diarrhea and dehydration. So when I say the GIT, I simply means the gastrointestinal tract. So what is now diarrhea? Diarrhea is a disorder of the GIT or a symptom of other disorders that is usually associated with increase in GIT motility. Any individual that is suffering from diarrhea tend to pass watery loose stool frequently. Diarrhea can be infectious and non-infectious, but from this explanation, we all can understand that the diarrhea associated with cholera infection is an infectious diarrhea. The question again that we need to ask ourselves is, what is dehydration? Dehydration occurs when the body loses its water content to the quantity that it is now lower than normal. Dehydration, usually when it occurs, it affects the way the body functions. This is because dehydration tends to upset the electrolyte balance of the body. And when we say the electrolyte balance of the body, we mean the salt and the sugar content of the blood. Having established these two facts, it is very, very imperative for me to mention that cholera infection is almost completely eradicated in certain industrialized nations and countries of the world, like Australia, Canada, United States of America, and most countries in Europe. They were able to attain this level through the use of modern treatment plants in management or in treating of their waste product. Secondly, through the assurance that the general public only consume treated water. However, in most underdeveloped and developing nations of the world, like Africa, Southeastern Asia, and Haiti, cholera infection still exists. And the reason why it still exists is basically due to poor sanitary condition. Having said this, the next thing we are going to talk about is what actually causes this cholera infection. Cholera infection is caused by a bacteria called Vibrio cholerae. Vibrio cholerae is a gram-negative bacteria that is facultative anaerobe and have the shape of a comma. When we say anaerobe, we mean those microorganisms that do not require oxygen for their survival. These anaerobes are generally divided into two: the obligate anaerobes and the facultative anaerobes. Obligate anaerobes are those anaerobes that can survive both in presence and in absence of oxygen. However, the facultative anaerobes are those anaerobes that can only survive in absence of oxygen. Vibrio cholerae belongs to this group of anaerobes that can only survive in absence of oxygen. This means that presence of oxygen tends to intoxicate this group of anaerobes. Vibrio cholerae naturally lives in brackish and salt water, where they easily get themselves attached to the shells of sea animals, particularly crab, prawn, and also other shellfishes. They stay there and they get themselves ready for infection whenever individual consume water that contains these sea animals. Having established this fact, the next thing we are going to discuss is what is then the risk factors associated with cholera infection. It is imperative for me to also say that every individual is susceptible to cholera infection. However, infants that are feeding from mothers who have had cholera infection before tend to have decreased susceptibility to cholera infection. This is because the mother naturally transmits or transfers immunity against cholera infection through the breast milk that the baby feeds on. Having established that every individual is susceptible to cholera infection, it is still very important for me to say that there are certain factors that can increase susceptibility to cholera infection, and this is what we refer to as the risk factors of cholera infection. And that leads us to the risk factors now of cholera infection. Basically, there are 4 risk factors that is associated with cholera infection. Number 1 is poor sanitary environment. Studies have proven that the Vibrio cholerae, which is the bacteria responsible for cholera infection, tends to survive and flourish more in environments where good sanitary condition is difficult to maintain. We find some of these conditions in certain places like the refugee camps. We can also find this condition in highly impoverished nations of the world. And finally, we find this condition, this environment, in countries that has been wrecked by famine, natural disasters, and war. The second risk factor is blood group O system. Research has also proven that individuals that has blood group O group tend to have increased susceptibility to cholera infection when compared to other individuals with other blood grouping system like blood group A, AB, blood group B. However, scientists have not been able to find the correct explanation why there is discrepancy in the susceptibility of cholera infection when taking blood grouping system into factor. So many researchers are still working tirelessly to provide a better explanation as to why this discrepancy exists. The third risk factor to cholera infection is absence or decreased quantity of gastric acid. Research has also proven that the bacteria responsible for cholera infection, which we have established earlier, that is known as Vibrio cholerae, tend not to survive and flourish in acidic environment. So the gastric acid naturally provide protection against this Vibrio cholerae. So when any individual have a decrease or completely absence of gastric acid in the GIT now begin to serve as a medium, or it begins to provide a medium where the Vibrio cholerae can survive and flourish. This kind of individual is usually individuals that are taking drugs that target reduction of GIT hyper acidity. Probably they have ulcer, or they have Zollinger-Ellison syndrome, or they have conditions that is as a result of increased GIT acidic content. So when they are taking these drugs, instead of reducing the stomach acid to the normal range. Sometimes it reduces it below the range. So these individuals tend to have increased susceptibility to cholera infections. These drugs that we're talking about here include antacid, like your aluminum hydroxide and your sodium hydroxide. These also include your proton pump inhibitors, like the omeprazole and the esomeprazole. These also include your H2 antagonists, like your cimetidine and ranitidine. And then finally, the last risk factor to cholera infection is household exposure. Yes, individuals living with a cholera patient in the same household tend to have higher susceptibility to cholera infection than the other. Having established this fact, we are going to move forward to explain the symptoms associated with cholera infection. When cholera infection starts, it's usually characterized with two basic symptoms, but as it progresses, it tends to bring along other complications, which some individuals can also refer to them as symptoms. So the two basic symptoms of cholera infection include diarrhea and vomiting. When we talk about diarrhea in cholera infection, when the bacteria causing cholera infection get into the body, it travels immediately to the intestine, and when it gets to the intestine, it starts releasing toxins. The effect of these toxins is that the toxin increases the quantity of water secreted by the intestine. So when the quantity of water secreted by the intestine is increased as a result of this toxin, the GIT motility, the intestinal motility also sets in. And this intestinal motility that is now higher above normal is now what we call the diarrhea. The diarrhea in cholera infection is usually pale and milky in color. It usually resembles or look like the water that has been used to rinse parboiled rice. Some of you that like cooking, or some of you that are chef, will understand in clear vision the type of water that I'm trying to explain here. The second symptom of cholera infection is vomiting. Vomiting usually starts with nausea, which is the urge to vomit. So initially, when cholera infection starts, it is associated with the nausea and vomiting. So having established this fact, we are also going to talk about the complications associated with cholera infection. When we say complications, we mean other negative, debilitating effects that this infection can bring to our body when it is not properly managed or as it progresses. And number one is dehydration. Dehydration in cholera infection is basically as a result of diarrhea. Immediately cholera infection starts, diarrhea ensues, and individual that is suffering from cholera infection can lose about 1 liter of fluid in 1 hour. The dehydration is very dangerous because it generally leads to most of the complications associated with cholera infection. For example, dehydration, which leads to loss of the body fluid below normal, tends to upset the body electrolyte balance. And when the body electrolyte balance has been upset, it usually results to muscle cramps and the hypovolemic shock associated with cholera infection. Apart from this complication, the second complication of cholera infection is hypoglycemia. Hypoglycemia is a condition where the quantity or the level of glucose in the blood has reduced below normal. Hypoglycemia is a complication that is more commonly seen in children. Hypoglycemia occurs because cholera infection tends also to make their patients lose appetite for food. And when patients who is suffering from cholera infection has lost appetite to feed, the glucose content of the blood will greatly drop down, and this is the reason why they cause hypoglycemia. Apart from this, cholera infection also leads to hypokalemia. Hypokalemia simply means a condition where the blood potassium level has been reduced below normal. Fluid loss as a result of diarrhea and vomiting usually upset the electrolyte balance, and one of the ingredients of the electrolyte that is upsetted or lost is potassium. So when the body continues to lose fluid, they are at the process also losing potassium. So at a point, the blood potassium level will be reduced below normal, and this now leads to the cardiovascular complications associated with cholera infection, like irregular heartbeat. Another complication of cholera infection is kidney failure. Yes, cholera infection, when not properly managed, can lead to kidney failure. Kidney is said to fail when it can no longer purify the blood to remove toxins from the blood and then get it out of the body through the urine. Cholera infection, when not properly managed, when taken for granted, can lead to kidney failure. So you have to note that point. Then finally, cholera infection can lead to death. Yes, as we have said earlier, that the NCDC have reported that 30 deaths occurred already from this dangerous and deadly infection. Also, Lagos state government has made a publication that has explained this point to all and sundry. So what am I trying to say? That cholera infection, when not properly managed, can also result to death. So the next thing we are going to talk about now is, what do we need to do to protect ourselves from contracting these deadly bacteria? What you need to do to protect yourself from these cholera infections and its complication is basically simple, and the most important thing you need to do is to maintain good personal hygiene. Ensure that you wash your hand regularly. You don't not just to wash your hand regularly, but you have to wash your hand according to specification. It is expected of you to wash your hand with running water and not stagnant water. And also, it is expected that you use a detergent. It could be a soap or a liquid detergent. Apply it on your palm and rub the two palms, rub your two hands together for some minutes before you can rinse your hands using a running water. And I say a running water, not a stagnant water. It is also very, very pertinent that you wash your hand according to this specification after making use of the toilet, or when you want to consume anything, when you want to put anything in through your mouth to your stomach. Secondly, avoid eating food that you don't know how they were prepared. This is because cholera infection can also survive in already cooked food that has been contaminated. Thirdly, avoid eating seafood that are not properly cooked or that are half done. This feeding habit is generally seen among the Chinese, but avoiding this will greatly reduce your risk of contracting this deadly bacteria. Then the number 4 thing you need to do to protect yourself from this cholera infection is to always stick to fruits that you can peel before consumption. This is because the Vibrio cholerae has the ability to cling on the surface of these fruits. So when you consume them, when they get into your body system, they move directly to your intestine, where they release toxins and then bringing about the complications like diarrhea and all other things we have talked about. Also, make sure that you wash your vegetables with clean water more than twice before using them to cook. And then finally, take your cholera vaccine. When we talk about vaccine, so many persons tends to have trepidation about vaccine. Vaccines, what it does to your body is that it prepares your body against any infection. Vaccines you see in the market are either attenuated viruses or bacteria, or even substances collected from these viruses or bacteria, but then they have been rendered harmless. So when these vaccines are injected into your body will first of all identify them and prepare itself against the real bacteria or virus that will be coming. So it is very prerequisite that you take your cholera vaccine to build immunity against these deadly bacteria. The cholera vaccine is recommended for individuals from the age of 2 to 64 can take this vaccine. The vaccine is usually taken when you know that you are in an environment that is having the epidemic of cholera infection. So these are the things you need to do to protect yourself from these infections that is deadly and currently taking lives of people. Having said this, I would like to ask, did this video add any value to your knowledge? If yes, go to my YouTube channel, click on the subscription button, put on your notification button. But if no, I am sorry. I promise to make it up to you in my next video. But what you still need to do is to go to my YouTube channel, click on the subscription button, put your notification button on, so that when I post the new video I'm going to post, you'll be able to access it. Also, don't forget to follow me on all my social media handle. So at this point, I would like to say thank you very much for your audience. See you in my next episode.